Hi Miriam, how are you?
Good, thanks.
My name's Alice, I'm going to be the student RN looking after you today. I'm just going through your documentation and what the doctors want. They just want to start some morphine for your pain. Could I get you to tell me your full name and date of birth, thank you?
Miriam Adib, 7th of the 1st, 1969.
Beautiful. And I'll just check your MRN is 174963, 174963. And do you have any allergies?
No.
Beautiful. Miriam, I see that you've got some fractured ribs, so I just wanted to ask you, how bad is your pain from 1 to 10?
8 out of 10.
8 out of 10. And when did it come on?
This morning.
Okay. And is it continuous or comes and goes?
Continuous.
Okay, great. I'm just going to have a look at your cannula. How long's this cannula been in?
This morning.
Okay, great. It's not sore to touch?
No.
Beautiful. No worries. So start a PCA, which is some morphine that you control for your pain. I'll go and get that sorted. But first of all, I'd do a set of baseline vital signs and put them on the PCA chart. Brooke, could you be my second RN to just validate the drug order?
Yes.
Okay, so we have Miriam Adib. Her MRN is 174963, born on the 7th of the 1st, 1969. So the doctor's ordered a morphine PCA, 50 milligrams and 50 mils for her broken ribs. We know she has no known allergies. It's been signed by the doctor, dated, and it hasn't been given. So it's PCA via IV, morphine 1 milligram in 1 mil. She's got 3 syringes charted. The PCA dose is 1 milligram in 1 mil with a 5-minute lockout, nothing continuous, and an hourly dose of 12 milligrams, signed and dated by the doctor. And we have Maxilon, antiemetic charted, and naloxone if we do need to reverse it. So if I didn't know, I would look in the MIMS, but I know that we're giving morphine and narcotic analgesia used to treat moderate to severe pain. Contraindications I wouldn't give if she's had any other strong analgesias today or if she's had a previous allergy to the same. I know that morphine can be given by a PCA, which is IV injection. Nursing looking out for is doing her vital signs, looking for respiratory depression, administering antiemetics if she feels nauseous, watching if she feels itchy, and that, yeah. And I know the 50 milligrams and 50 mils is a normal dose from the MIMS. It's compatible with normal saline and it is able to be given through IV through the PCA pump. Now I'm going to go gather my equipment and do my first drug calculations, which I've got. Strength required over strength in stock is 50 milligrams over 10 mils times 2, so we need 10 mils of the drug, which is 50 milligrams divided by 10 is 5 ampules. And we need to dilute it in 4 normal saline ampules, which is 40 mils of normal saline. Brooke is my second RM. We're just going to collect our drugs. And fill out the drug book. So if I can use this just to compare, we have Miriam Adib, amount given is 50 milligrams. It is 10 o'clock on the 9th. Name a prescriber. And I'll just do my first count. So we have 1, 2, 3, 4, 5 of morphine, 10 milligrams in 2 mils. 6, 7, 8, 9, 10 of morphine, 10 milligrams in 2 mils. 11, 12, 13, 14, 15 of 10 milligrams in 2 mils morphine. 18, 19, 20 morphine, 10 milligrams in 2 mils. 25, 10 milligrams in 2 mils. So the beginning count is 25, and we're going to take away 5 and put back 20. Are you happy?
Yes.
And we'll put the other 20 back. So Brooke, I'd like you to be my second RN to do my first drug check, please.
Yep.
Okay. So we have morphine 50 milligrams in 50 mils. PCA IV is the route. It hasn't been given, it's signed and dated by the doctor. Sorry. So we have morphine, 10 milligrams in 2 mils, 2020 for IV injection. Morphine, 10 milligrams in 2 mils expires in 2020 for IV injection. Morphine, 10 milligrams in 2 mils expires in 2020 for IV injection. Morphine, 10 milligrams in 2 mils for IV injection expires in 2020. And morphine for IV injection, 10 milligrams in 2 mils expires in 2020. So 50 milligrams of morphine in 10 mils.
Yes.
Now I'm just going to draw up my morphine.
Morning, Miriam. My name is Tina, and my student name is Guzewicz. Just for your medication start, and I can see the doctor has already given you some walking for your body. Is that okay with you? Yes. And before I can give you your medication, can I please ask you to tell me your full name? Miriam. Yes. And your date of birth? 71. Look at your wristband to verify your MRI.
So I have 10 mils of the drug. So Brooke is my second iron. I'd just like to show you I have 10 mils of the drug.
Yeah.
Happy? So Brooke, I'd like to do my second drug check, please. So we have the patient, Miriam Adib, MRN 174963. Date of birth is the 7th of the 1st, 1969. She has no known drug allergies. We're giving her morphine 50 milligrams in 50 mils, which we know is compatible with normal saline. So we have 10 mils of the drug. We have morphine sulfate for IV injection, 10 milligrams in 2 mils, expires in 2020. Morphine sulfate, 10 milligrams in 2 mils for IV injection, 2020. Morphine sulfate, 10 milligrams in 2 mils for IV injection, expires in 2020. Morphine sulfate for IV injection, 10 milligrams in 2 mils, expires in 2020. And morphine sulfate, 10 milligrams in 2 mils for IV injection, expires in 2020. And this is my diluent. We have sodium chloride, expires in 2018 for IV injection, 10 mils. Sodium chloride expires in 2018 for IV injection, 10 mils. Sodium chloride expires in 2018 for IV injection, 10 mils. And sodium chloride expires in 2018 for IV injection, 10 mils. And this is all going through an IV infusion through a PCA pump. So I'm just going to fill out my fluid additive label, morphine 50 milligrams in 50 mils in 40 mils of normal saline. Do you agree, Brooke? As
Yes,
my second iron?
I do. Oh.
I'm just going to change to a clean needle to draw up my diluent with normal saline, which we know is compatible. So Brooke, I have 50 mils of the drug and the diluent.
Yeah.
I'm now going to prime my line. Line primed, no bubbles.
Yep.
Just got to put my additive label on the syringe. And take it over and put it in the PCA machine, Brooke, if you don't mind coming. Brooke, can you just watch me set up the PCA machine, please? Clear previous patient. Okay, so we have morphine, 1 milligram in 1 ml. PCA dose is 1 milligram, 5-minute lockout, nothing continuous, and a max dose of 12 milligrams in 1 hour. And we have morphine. Concentration is 1 milligram in 1 ml. PCA dose 1 milligram, 5-minute lockout, and a max hourly dose of 12 milligrams, signed and dated by the doctor, hasn't been given. Are you happy?
Yes.
Brooke, do you mind just coming with me to check my patient identity? Thank you. Miriam, I've just got your pain relief here. Could you please tell me your full name and date of birth? Thank you.
Miriam Adib, 7th of the 1st, 1969.
And her MRN is 174963, 174963. And do you have any allergies?
No.
No, great. So Brooke, I just need to do my final drug check with you. Thank you. So we have Miriam Adib, 174963, 7th of the 1st, 1969. No known drug allergies. Morphine, 50 milligrams in 50 mils. Via PCA IV injection, signed and dated by the doctor, hasn't been given. We have morphine, 10 milligrams in 1 ml for IV injection, expires in 2020. Morphine, 10 milligrams in 2 mils for IV injection, expires in 2020. Morphine, 10 milligrams in 2 mils for IV injection, expires in 2020. Morphine, 10 milligrams in 2 mils for IV injection, expires in 2020. And morphine, 10 milligrams in 2 mils, expires in 2020, so 50 milligrams. And my diluent is sodium chloride, expires in 2018, 10 mils for IV injection. Sodium chloride, September 18, for IV injection 10 mils. Sodium chloride, expires in 2018, for IV injection 10 mils. Sodium chloride, expires in 2018, 10 mils for IV injection. We'll just go and check at the PCA that we have. Morphine, 1 milligram in 1 ml, PCA dose of 1 milligram, 5-minute lockout, nothing continuous. Max dose is 12 milligrams in an hour. A PCA dose of 1 milligram, 5-minute lockout, nothing continuous. 12 milligrams, max dose in an hour of morphine, 50 milligrams in 50 mils. Signed and dated by the doctor, has not been given. Are you happy?
Yes.
So Miriam, I'm just going to connect up your PCA. So you've got your nice cannula here, has only been in for a day, doesn't look red or inflamed. So I'm just going to confirm the syringe. Take the key out. Okay. So Miriam, this is your PCA button. So when this button is green, you can press it. Press it before you do anything that's going to cause you pain, like getting up, going to the toilet, and it will give you a dose of your drug. I'll come back and check up on you in about 10-15 minutes, but if you feel any nausea, itching, shortness of breath, just hit your button and I'll come up and have a chat with you. Just close it right. And Brooke, if you can just sign the drug chart with me, thank you. We have the 9th of the 5th, 17 at 10:15. And then you sign. And here's just the PCA OBS chart where I'd fill out my PCA OBS as per protocol.